Hello, lovely viewers. You are welcome once again to yet another episode on Official King's Speech TV. With you in the house is your girl, Erikwa Ofosunyema. Thank you so much for being here with us. This evening or today, we have in our midst dear sister who is well versed in the health sector, and she's going to have a discussion with us about pregnancy. And she's in the person of Miss Nadia Nancy Beach, and I know she's no stranger to you. So stay glued to your seats as we unfold these discussions with you. Miss Nadia, you're welcome to Official King's Speech TV.
Thank you. Hello, viewers. I haven't seen you in a while. Hope you are all doing well.
All my viewers, there's a warm greeting to you from Miss Nadia, and I know you're all doing well because I always have discussions with you. Okay, Miss Nadia, today we are talking about pregnancy. Now, when we say pregnancy, what is pregnancy?
So when we say pregnancy is you conceiving and then being able to hold it to term. That is pregnancy.
Okay, so conceiving and being able to hold it to term. So if I'm understanding it in a layman's point of view, it is something entering your stomach, or like food.
So when you say like that, then we have to go to fertilization. Okay, so fertilization is when the sperms meet the ova and then they become fertilized, then it forms a fetus. Okay, so whilst the fetus is growing, we say you are pregnant. So that's pregnancy.
So that's the conceiving, or the conception.
Conception.
Okay, so this one that she has explained. So she has explained conception to us. It is when the sperm meets the ovaries and then they fertilize into whatever comes into the stomach, and the stomach begins to grow like big. To term, that is the right time it's supposed to stay there.
Yes.
Okay. So if I'm getting it to term, that means there are some pregnancies that don't get to term, right?
So we have pregnancies that don't get to term, and then we have pregnancies that stay over. So we have preterm and we have postterm.
Okay, so if I'm asking what is the term?
So term is 40 weeks. Okay. We estimate that pregnancy is supposed to last for 40 weeks.
Okay.
And then you deliver. Okay. But we also estimate that postterm starts after 42 weeks. And then preterm is before 32 weeks.
Okay, so the preterm will start before 32 weeks and the postterm will be after 42 weeks. So that means if you fall within 32 to 42, you are still in the term.
So usually for us, when you are 10, it's usually between 36 to 42.
Okay, so usually between 36 and 42, that means you've gotten the full term of the pregnancy.
Yes.
Okay, now, sometimes I hear people say, I'm in my trimester, I'm in my first trimester, I'm in my, I don't know, say, yeah, school no more, trimester, or say, semester no more. Sometimes I don't understand. I ask myself, trimester, say, what is that trimester they've been talking about?
So, pregnancy has been divided into 3 stages.
Okay.
So we have 3 trimesters.
Okay.
That is the first trimester. That's the first 3 months. Okay. The second trimester, which is the next 3. So that is 4, 5, and 6. Okay. And then we have the third trimester. Okay. Which is the 6 to 9.
Okay. So in simple terms, the first trimester is your first 3 months. Your second is your middle 3 months, and your third is your later part, the 3 months left. Now, we've talked about this pregnancy. Now, how will I know I'm pregnant? I'm there. What will make me know that, Jack, I'm pregnant? I have to do something about it.
So, whenever our body is going through anything, it gives us some signs to let us know that this is going on.
Okay.
So, when you become pregnant, your body will give you some signs to let you know that you are pregnant. Okay, so sometimes you feel your breasts become a bit heavier. You sometimes get nausea, you vomit. Sometimes you have lots of appetite. Sometimes your body goes through some changes. Sometimes you can see some spots on your face. All these things are things telling you that something is going on.
Okay.
But then also the surest way for you to know that you are pregnant is to do a test. That's the pregnancy test.
Okay.
That is the positive thing to tell you that, oh yes, you really are pregnant.
Okay. So can we say there are some people who didn't go through any signs and symptoms when they are pregnant?
Yes, some people don't go through anything. They don't even realize that they are pregnant. Sometimes also you go through some things, but we don't take note of them. So we assume that we didn't go through anything.
Okay.
But then also, most at times, your body will definitely give you something for you to know that something is going on. But sometimes we don't pay attention to our body, so we are not able to tell that this is what my body is telling me.
Okay. So let's go back to the test. Now, okay, I'm having symptoms. I'm having nausea. Maybe I'm having headache. Maybe I'm having cough. Okay, these things, do I think they are pregnancy symptoms? Now, when do I have to test for me to get a positive result that I'm pregnant?
So when you're pregnant, we have a hormone called HCG. That is what we test to see if you are pregnant or not. So when you become pregnant, it takes about 2 weeks for the level of the HCG to be high enough for you to be able to test and know that you really are pregnant. So before the first 2 weeks, when you test, the hormones are not that high, so you will not get a positive result. So you might think that you are not pregnant, but after 2 weeks, the HCG level goes up. So when you test, you get a positive test result, and then you know that, oh yes, I really am pregnant. Okay. So you test after 2 weeks.
Okay, so after 2 weeks of being intimate with a man, or after 2 weeks of realizing I'm seeing, okay, so are you trying to tell me that these symptoms, these signs and symptoms, I'll realize them after 2 weeks? The nausea and all those things, I'll realize it after 2 weeks of doing something.
So it's not always after 2 weeks, because as I was saying, the hormone has to increase for you to get the positive test result. Okay. But then also, it's that increase in the hormone that will let you feel those signs. So sometimes before 2 weeks or during 2 weeks, you might not get those signs because of the level of the hormone. But as the level of the hormone increases, you get to start feeling these signs and symptoms that will tell you that you are pregnant. So most of the times during our first month of pregnancy, we usually don't notice. So you not know that you are pregnant. Sometimes the signs will be there, but because the hormone level is not too high, the signs might be mild. So you not realize that you really are pregnant. But after the first month, because the hormone has increased, these signs will start manifesting and will increase in their regularity and all those things. And that will let you know that there's something going on. So let me verify.
Okay. Viewers, you are still with your girl Irekwa Ofosehema, and with me is Miss Nadia Nancy, and then we are talking about pregnancy. We want to know what pregnancy entails, how I know I'm pregnant, what I'm supposed to do, and all that. So back to you, Miss Nadia. Now I'm pregnant. What next? What do I have to do? Do I have to sit in the house and put my hands in between my legs and soak from morning till evening? What next? What do I have to do to ensure that I am safe? Oh, I'm okay.
So let me chip in something here. In our part of the world, we usually don't like going to see the doctor or anything. But ideally, even before you become pregnant, we have something that is called preconception care. You and your husband or your partner have to go and see your doctor, your gynecologist, your midwife, even before you become pregnant. So they start taking care of you and prepare your body for pregnancy, even before you become pregnant. But it's not something we actually do in our part of the world. So immediately you realize that you are pregnant, you are supposed to go to your midwife to tell them that you are pregnant, and then they start taking care of you right from when you realize that you are pregnant.
Okay, so that means that when I realize I'm pregnant, the next ideal step I'm supposed to take is go to the hospital.
Yes.
Okay. Now, some people are like, maybe call hospital and drown on whatever mommy and grow my brain and my baby. Now let me just stay in the house. After all, when I go, is these normal drugs they are going to give to me? Is it ideal for someone to decide that, okay, let me wait till my first trimester is over before I go to the hospital?
Actually, immediately you realize you're pregnant, you're supposed to go to the hospital. It's not just the medicines that they are going to give to you. When you get to the hospital, you have to do scans, you do labs, you have to test and see, is everything going on well? Is everything normal? Where is the baby situated? Oh, sorry, where is the fetus situated? Is the situation normal? Is everything going on well? Has everything taking its right or appropriate course? Because there are some times that some things may go contrary to what we expect, and then interventions have to be quickly put in place to help save you or your baby. But then if you don't come to the hospital, no one knows what is going on, so there's nothing anyone can do for you at that time. You might come to the hospital later on and we realize that things have gone contrary to what we expect, and that might lead to your health being compromised or the health of your fetus being compromised. So it's better for you to go and see your midwife immediately you realize that you are pregnant, so that they can start taking care of you.
Okay. So if I'm understanding this whole thing, the moment I realize that I'm pregnant, the next thing I have to do is go to the hospital.
Yes.
Now when I go to the hospital, the midwives are going to prep the body for this new pregnancy that is coming in. Okay. Now, in the beginning, we were talking about full term or term. Now, what happens to the babies or the fetus that don't get the full term?
Okay, so when you don't get to full term, then we realize that things are wrong. So we usually put those babies in the incubator. Okay. The incubator is like an artificial womb that is there to help them survive outside of the uterus. So we put them in an incubator to help them for that duration. So we realize that they are okay. Then they are discharged home. Of course, the mother will be educated on certain things to do at home and how to take care for the baby. So that's, because they are not at term, their immunity is compromised. So there will be some medication and all that for them.
Okay. So those babies though who are not able to get the full term, they are the pre-term babies.
Yes.
Those who are not able to get it, they are put in an incubator to help them sustain them till the term is due.
Not till the term is due, but then we put them in the incubator to monitor them and see if everything is okay. If the baby is able to survive on its own, can breathe on its own, can feed on its own, can do everything, then the mother is allowed to go home with the baby.
So I remember some time back I heard something like kangaroo, and I was asking myself, like, kangaroo is supposed to be an animal. Why am I hearing kangaroo in the hospital? What is kangaroo, and how does kangaroo come into play with pregnancy?
Okay, so we have something called kangaroo mother care.
Okay.
As you can see, the animal, the kangaroo, the female kangaroo has a pouch in front. That's where it keeps its baby. So we adopted that system in healthcare. When the baby is born, because the baby is preterm, a lot of things don't go or a lot of body functions don't work as well as they are supposed to. And then every baby needs a lot of warmth. Warmth is what will help the baby to survive, because the baby is preterm, the skin is light, the respiratory system is not that well developed, the lungs, the kidney, everything is not that well developed. Okay, so when we put the baby in between the mother's breast and wrap the baby with the mother, the baby gets natural warmth from the mother, and that will help the baby to able to survive. Okay. Also, when the baby is that close to the mother, the baby's heart doesn't know how to beat. The rhythm is not consistent, but when the baby is close to that mother, because the baby is listening to the mother's heartbeat, the baby's heart also learns to beat in regulation.
Okay.
So it also helps the baby, and then also it helps them to bond. Okay. So the baby knows that this is my mother. Okay. And kangaroo mother care is not just for the mother, it's for the mother and the father. But then also in our system, we realize that most of the men don't get as involved with the babies as the women. But when you go to the hospital, you tell them, oh, I'm the father, I also want to bond with the baby. Kangaroo mother care can also be done for them.
So that one will be called kangaroo father care. I've invented it. Like I said, I've made my own invention. Is it a kangaroo father care? Sorry for that. kangaroo father care. That is when the father is also bonded with the baby through that kangaroo system. I'm already liking the thing because I'm imagining your baby being so close and wrapped to you. Even the joy you have when you see your baby on your lap, let alone having the baby close to your chest and wrapping the baby, you know, that kind of, in fact, I just wish I could go through that, but well, I didn't go through it. And anybody who goes through it, I hope it's going to be a really exciting experience for you, because the name is even making me laugh to try something like that out. Okay, now we've talked about preterm. Now post-term. Babies who do the post-term, now do they have disabilities? Are they normal? What makes them go into that post-term situation?
So ideally, for labor to set in, the body just has to tell the brain. The body has to tell the brain that it's time. The baby has to come out. Okay. But then sometimes those signals don't really. The message doesn't get to the brain as quickly as it should. So sometimes the baby stays a little longer than the baby is supposed to. Yes, but they are normal, everything is okay. The baby comes, everything is normal. Okay. So they are normal babies, there's nothing wrong with them.
So when a baby is post-term, do you induce the labor, or they sometimes get the normal pain for labor, or you have to do cesarean, or like?
So with post-term deliveries, we wait and see. If labor doesn't set in on its own, then we come in and then induce labor to get the baby to come out. But then also, if we induce and still we see that there might be some complications or anything, then we quickly go in for a cesarean section, and then we are able to deliver the baby.
Okay. So then that means it's not an ultimatum that when there's a post-term situation, it has to be cesarean. We can have a post-term situation, but it will be a normal delivery.
Yes, we have a post-term situation, then it will be a normal delivery. But then also, it all depends on a lot of things. The mother's health condition, the mother's parity, how many children the mother has the mother undergone cesarean section before. A lot of things come into play before we decide whether we are going to induce labor or we are going to go in for cesarean section. So it's not clean cut that immediately you come, we are going in for cesarean section, and it's not clean cut that we are immediately going to induce labor. We have to look at a lot of things before the decision is made, and of course the mother is advised on everything that is being taking place, so that you know which option to choose and then the best option for you.
Okay, so post-term. Now in post-term, we've analyzed the body and seen everything is okay. Maybe we've gone through the normal process, we've got our baby, we went through induced labor, we got it, cesarean, whichever way we got it. But there was something I forgot to ask. During the pregnancy, now can someone just decide that, okay, when I eat fruits and vegetables, my baby is going to be good and strong, so I can just omit drugs and just be on food, veggies, maybe fruits, and then just omit drugs? Can someone just do that?
So when you are pregnant, your body actually demands for more nutrients. So the medications you are given, it's not just medications, but they are usually to help with the nutrients that your body actually needs. And then you get it from food, yes, but sometimes you're not getting the correct quantity you need. So these medications come in to help the body to get all its required nutrients. So when you decide to depend solely on food and you don't go for the right choice of food, you'll be depriving your baby. So it's advisable to take the medications so it will help your baby.
Okay. So viewers, you've all heard it. It's not that they just give us these medicines because they think we should just take any medicine because we are pregnant. No.
Also, let me chip in. Like for instance, something like folic acid. Folic acid is good to prevent the baby from getting spinal bifidus. Okay, so when you take folic acid during pregnancy, it's helping you in that aspect as well. So it's not just because your body needs folic, so we are giving you folic acid, but we're also trying to prevent your baby from getting spinal bifidus. So all the medications that are given to you during pregnancy are all there to help you and your baby. So we want you to have a healthy baby. That's why you have to take the medications.
So Miss Nadia is saying that we want a very healthy and bouncy baby. That's why you're giving medications. You're not giving medications because the midwives want to punish you. It's not because we're not yet now hospital now we the day. The midwives want to help you and help the baby too. Because the baby is not only your responsibility but the responsibility of the society at large. So the drugs are given to you so that you can help facilitate the growth of the baby. That is why we are giving the drugs. We've gone through our time of pregnancy and everything has gone well. By the grace of God, we've gone through our full term and we've got a very bouncy baby. Now, when you hear some people doing then that means the time is up. Somebody wants to come and see the light. And then after that comes to someone to come out and hear I want to ask, is it a must that every baby must cry the moment it comes out of the womb?
That is a golden minute. Immediately every baby comes into this world, the baby has to cry.
Okay.
When the baby cries, you see, when the baby is in utero, they don't breathe. Okay. Their lungs are occupied by fluids because of the amniotic fluid the baby is swimming in. But then when the baby is coming out, through the mechanism of labor, that fluid in the lungs is pushed out. So immediately the baby comes, the baby has to cry. So the baby takes in oxygen. So the lungs will start working. Okay. It will close some of the valves that were open in the heart that was helping with blood circulation. So the circulation will change from that of a fetus to the adult circulation. Okay. So during that 1 minute that the baby is crying, a lot of things are going on in the body. Okay. So when the baby doesn't cry, the baby doesn't take in the oxygen, a lot of problems can come out of that. Okay. So it is essential. That is why we call it the golden minute. Wow. Because that first minute is very important to our babies. Okay. So we expect and we want that our babies to cry even if immediately they come. Yes. Because when you don't cry, a lot of things are going wrong. So
I remember having that experience. Let me show you a story. I remember one time one of my babies, okay, the baby wasn't crying. I had a baby. Because I was wondering what went on. So I went to ask the midwife, I had some sound. What did you say? Hey, your baby didn't want to cry. I had to make it cry. So that is really the golden minute.
Yeah, that's our golden minute. We really need that.
Oh, wow. Okay, so babies have to cry the moment they come from the womb. Wow. Well, we are learning something today. I didn't know there was something called the golden minute even in midwifery. Today we've heard something that is very, very interesting. Now, after the golden minute, when the baby comes out, you realize that they normally put the baby either on your chest or on your womb. Is it a tradition or is it something they're supposed to do? Like, I don't see why when the baby comes out, is this something that you do to do something?
Well, when the baby comes out, that is the first minute. Of course, the baby has to bond with the mother, okay, first of all. Secondly, we need to work on the baby immediately the baby comes out. And the mother is the closest person at the moment. Okay. So we place the baby on the mother's abdomen so that we can work on the baby quickly. And then also during that time, the baby hasn't been separated from the mother. Okay. So we can't take the baby away. We have to separate the baby from mother. Okay. So when we place the baby there, we're able to work on the baby, separate the baby from mother. And then also for warmth, so we allow the baby to lie on the mother's chest for some time so that the baby will bond with the mother, the baby will get warm, and then the baby will hear mother's heartbeat. So all that goes on there. Okay. And then we also use that to regulate baby's temperature. So while the baby is lying there, the baby's body will adapt to the mother's temperature. Okay. So all those things goes on.
Okay, so I think that been delivered of and the baby is out and then they are just putting the baby on me, but subconsciously you are working, you're doing a lot of things at that moment that I'm not even aware of.
So we always tell the mother when you come in labor that when your baby is delivered, we'll put your baby on your abdomen. So you always make the mother conscious of that fact that we are going to put the baby on your abdomen. We don't want you throwing your baby away or anything like that. Yeah, so we make you aware. But then during that time, a lot of things is going on.
Wow. A lot of things are going on. I've had my experiences countless times. And I'm hoping that every woman is going to have her own experience. But then at that moment, as sometimes are the fathers allowed to also enjoy that moment?
Oh, fathers are allowed to enjoy that moment. But then the thing is that in our setting, sometimes the labor ward is not just for you.
Okay.
You come to the labor ward and there are lots of women delivering, so we can't allow the husband to enter at that time because a lot of people's wives are also there. But yes, if you have a hospital that has a delivery room that is for one person, the fathers are allowed to come in and also experience it.
So can you give the baby to the father at moments like that?
When we separate baby from mother, yes, we can give baby to father.
Wow. I'm just liking it. I wish I could get pregnant again, but my time is over. Okay, so lovely viewers, it's still your girl, Erekwa Ofosonyema, with you in the building. And we are still with Miss Nadia, who is a health professional. She's a midwife, actually, and she's educating us on pregnancy and what it entails. I have learned a lot. I know you have learned a lot. Like I always say, I'm always here for you. If you want to continue enjoying more content, if you want to continue enjoying what I do, if you want to continue seeing everything I post, don't forget to like, share, subscribe, hit the notification bell so that anytime I upload, you'll be the first to hear it. Now we are about wrapping up. We are going to our final words. Miss Nadia, what can you say about pregnancy to us? Pregnancy in general. What are we supposed to look at? What are we supposed to do? The pros, the cons. Just give us a little wrap up and then get going.
Well, all I have to say is that pregnancy is a very nice experience, but then it can also be a very dangerous and difficult experience. So when you become pregnant, please try as much as possible to go to the hospital and see your midwife. Whatever hospital is close by, please just go to the maternity department, tell them you are pregnant, you want to see a midwife. They will attend to you. When you feel anything, any adverse thing you feel, there's pain, there's bleeding, there's excessive vomiting, anything you feel, you just go and inform your midwife. They will attend to you. That is, you are the reason why they are there. So when you come, they are always available to take care of you. So please try as much as possible to see your midwife in any situation. Let them attend to you, and you will enjoy your pregnancy and you will also enjoy your baby. Thank you very much.
So Miss Nadia has said it all. Pregnancy is a very interesting jolly ride. And in fact, I always say that I wish every woman would go through that process of pregnancy, because pregnancy is very, very, very interesting. It's something that is so sweet. Now she's saying that when you attend to the hospital or the clinic and the midwives attend to you, you definitely enjoy your pregnancy and then you will definitely enjoy your baby. Please don't be left out. The moment you realize that, Jack, the thing is there, run to the nearest hospital. Get your baby connected to you through your scan and all those things, the ultrasound and all those things. Get to know your babies, talk to them, and enjoy the pregnancy period. This is your girl Erekwa Ofosonyema, and I'm still in the building with Miss Nadia, and today we brought you a segment on pregnancy. And as I always say, you are all I have and I'm here for you. So anytime you want to get a new video or anytime you want to get something interesting to listen to, go nowhere, just straight on to Official King's Speech TV. Like, share, subscribe, hit the notification bell so that anytime I upload, you will be the first to get it. Thank you very much.